All right, we are live. I know you said something to me, but if I'm not looking at you, I'm not going to hear you.
Oh, you said better than some. I said, was that sarcasm?
Yeah,
It
is.
Yes, ma'am.
I'm gonna get you set up on the meeting.
Thank you. In the hospital corner and all that. Because it was that work came up, they told me that work, the other almost there.
Trey, you ready?
Hey, Miss Charlotte, do I need to get my house to sign up for therapy session?
Talk with Casey about that.
Please, okay.
Four more minutes until restroom time. Other I said 4 more minutes until restroom time.
Yeah, that would be fun. Hey, baby. That was Dustin those. That was Dustin those.
Yeah.
Is that a sound you can go?
Dustin comes back. Come back.
He comes back,
Go to your room.
and William comes back too. But he
I
ain't
got
gonna
to share my
and say you ain't gonna do no fight.
Who's that? The book days were a terrible idea.
One time I don't even know what I was doing in my seats. I was in the top bunk, and me and the whole mattress still we were gone for. I have no idea what I was doing on the seat. Fighting something else.
Oh, you be my baby. Hey. Will you be my baby? Oh, baby. Thank you.
Good. So what? You.
Hey, record
You the man.
Drink this up.
What's up? I'm about to copy something.
Oh, okay.
And he was
Man, it's fine.
very.
Now you ready? You ready to go? Yeah, go. When you do that, you go. We're going that. Ooh. Let me get 8.1. Cordy comes with the horn. Since I got most of y'all here who wasn't here earlier, what's supposed to be on your beds? Nothing. So why I got all kinds of stuff on beds? From here on out, I don't want to see nothing on the beds. I don't want to see nothing on the desk but a Bible. Everything else goes in your closet. And I'm not going to keep repeating that. You're not so busy where you can't go put that up in the closet. Don't be lazy about it. Do it yourself. Done.
Well, good morning.
Good morning.
Man. Say it again.
It's today the 30th.
Is today the 30th? I think it's the 29th, huh?
Yes, sir.
Yeah, alright. Thank you very much. 29. I'm used to cheating with my phone.
Yeah, it's the 29th. You know, one of the things as I look around, that's one of the things that just come blowing out at me is that we all survived the holiday.
That's right.
Yeah. But there's another holiday on the way, right? New Year. So we're going to do some great stuff in 2026. So y'all just get prepared for all that 2026 stuff. It's just going to be, you're going to be excited about 2026. One of the big things about 2026 is most of you won't be here. not for the end of it. Yeah, hopefully you're going to get out of here. You're going to get everything done that you need to get done, and you're not ever, never, ever, never coming back over here except as an RA or as a counselor, as somebody that's doing some volunteer work or stuff like that. So, housekeeping, real quickly. We have sign-in sheets going around. Make sure that you get your name on there. Sign it legibly so that I can read it. And at North, I'm going to come by over there and pick that up after a while. I appreciate you guys. Y'all usually do a good job over there keeping it together. Sometimes I have to seek and find it because you keep it somewhere I don't know. But, it's always well written and all that stuff, and I appreciate that. So make sure you do that. My phone is still on today, and I do apologize for the fact that I hadn't been 100% in the last month. But today I get to go and see my cardiologist at about 2:30 this afternoon. So, we'll get, maybe we'll figure, or maybe I'll figure something out, get some things done. So if my phone goes off, y'all just, accept my apologies now. And, we'll have to do breaks. We're going to take breaks maybe when we need them today, because I'm still not, like I said, 100%. So if it gets to the point where I need a break, need to sit down, we'll just take a break. So also, we see some new faces. Everybody have a book? Do you have a book yet, sir? Back in the back. All right, make sure you let your counselor know that you need a book. She will get you a book. Miss Caitlin, the intake counselor who did all your intake stuff, she makes the books. And so if you don't have one, your counselor will go to Miss Caitlin and say, we need a book, and we'll get a book. This week is what's called Dead Week. You don't know why it's called Dead Week? Because more people die specifically in treatment facility groups during this. That's not true. That's not true. This is known as Dead Week because it's the week between Christmas and New Year's, and very little usually gets done during this week. People don't do much during this week. We don't do a lot of the normal stuff when we're in our offices or when we're out doing stuff. We don't usually do a whole bunch of stuff during this week, so it's come to be known as Dead Week. There are a lot of people who really enjoy working on Dead Week. Why do you think that is?
Not a lot happening.
Not a lot happening. You get the same pay. A lot of the time, the higher-ups, the bossy people, they're not here. They're not at that facility. They're somewhere doing something because it's Dead Week, and so there's nobody around. So you can just be there. And do what you do. But we are not like that. Well, we don't call it Dead Week. We call it Live Anyway Week.
That's right.
Yeah, we're here. We're doing it. So if you have your book, and sir, you will be getting a book, and I do apologize for you being in group without one. So when you come to group, bring your book, and we're going, we go round and round on this thing. So this week we're going to be looking real quickly at physical health and recovery. And one of the big things about this time of the year is that we're not really physically active this time of the year, and we do a lot of stuff like eating stuff. I will tell you that this year is the first year that my wife and I ate more decently and more healthily than we have in the past. She made a turkey, but we did not have, can you imagine? Yeah, I couldn't, but we lived through it. But she made a turkey with some Brussels sprouts and some broccoli and, some stuff like that. And we didn't have any corn casserole. We didn't have any, what's that other stuff? Stuffing. We didn't have any stuffing, cornbread dressing. We didn't have any of that. And we didn't have any pies of any kind. My son did bring a pie, but it was one of those store-bought ice cream pie things. It was a big old thing, and it was store bought cheesecake ice cream. It looked good. I didn't eat any of it. They ate it and then got rid of it. But we did really well. And then on Christmas we had a ham and the same trimmings. Well, the only difference we did have some corn, and so corn's not good for you, but it was good. But um, it made Christmas a little different because we usually eat so much you can't move and then go sit on the couch and watch football, stuff like that. But it was different, but it was more healthy. If you'll notice that we have a really well done painting over here, and what do you think this guy's doing?
I think he's doing yoga.
What's he look like?
I think he's doing yoga.
Doing yoga?
Looks like he's about ready
He
to do
looks
it.
strong.
Looks like,
Pretty strong.
looks like he's about ready to do an incline push-up.
Yeah, I think he's doing incline push-ups. But if that's how you do yoga, okay then.
Yeah, I think he's doing the thing where he likes
Hey, do it. You do it how you do it. But you'll notice the blank stare that he's got there. I had somebody tell me one time before that, when you're exercising, that's a really good time to think about things. And I haven't exercised in about a month because stuff. But when I'm lifting weights and stuff like that, I'm not thinking about stuff. You have to concentrate on what you're doing so you don't hurt yourself and all of that kind of stuff. But this guy's got a blank stare out there, and he don't look all that happy. But that's what you do when you're exercising. So exercise is important. Sure. And we're going to talk about some of the things that exercise do to us. Now, here's the deal, and maybe not you, because I don't know you that way, but I will tell you this, that most of us do not do a lot of good physical activity when we're using.
Sure.
When I use, I'm not doing other stuff. I'm using. I'm drinking, I'm smoking, I'm not exercising, I'm not eating right or anything like that. I'm still not eating right. And right now I'm not exercising, but I'm going to go to my doctor at 2:30 this afternoon, and hopefully they can tell me I can get back in the gym. Because I tell you, once you get into the gym and you do what you need to do in the gym, not being in the gym is bad. It's hard on you. So here's the thing. We're going to look at this. The first step, usually, this is not always that way. I know people who are bodybuilders who have issues with drugs and alcohol. It's not always... we're not always in bad health when we're in our addiction, but most of the time, most of us are. I know I was in pretty bad shape. So usually the first stage we look at it on page 21, it says our physical health is poor. I'm just getting into my recovery, and I'm not interested. Now here it says interested, but it's pretty obvious that that's not true. So we're uninterested and unengaged in physical health concerns. When my addiction has got a hold of me, the only thing I'm concerned with is when I'm going to get my next little bit of whatever I'm using. I'm not worried about it. I'm not worried about my physical health or anything. We also have some poor nutrition going on. That means, when I'm in my addiction, I'm eating what? Whatever I can get my hands on at the time. Yeah, because I'm not usually working, and so if you go into a place where somebody has some donuts on the desk, you just eat a couple of their donuts. You just get whatever you can. That, in my own experience, back in the day, nutrition was something I didn't think about at all. I would eat whatever there was to eat, and most of the time, in my own experience, there wasn't a whole lot to eat. I used to go to my aunt's house. And just for that purpose, I knew my Aunt Margaret had some food there at her house because she had some children she had to feed. So I slipped by there and say hello and all of that kind of stuff and grab whatever I could grab. And went over one day, there was absolutely no food in her house at all. And I'm thinking, wow, poor lady. I learned later on that she had gotten wind of the fact that I was coming over and she had cleaned up all the food. Put it, she didn't want me coming and eating her food. Yeah, so I can understand that. So my nutrition was just out the window like everything else. Poor or non-existent physical activity. I wasn't going to the gym when I was using. I wasn't taking walks when I was using. I wasn't doing any running when I was using. So, my health was probably pretty poor. So one of the things that we need to look at when we get into our recovery is, hey, where am I physically? Where am I nutritionally? Where am I with my sleep? Now, I will tell you, last night I didn't get a whole lot of sleep because several different things, but I just didn't sleep well last night. But so today we're going to look at some of the things. We all know that if we exercise well, it's going to help us feel better. Because here's the deal: you do better when you feel better. You're going to do better at your job. You're going to do better at your home. You're going to do better with your family. You're going to do better when you feel better. That's
it's almost like, you ever heard the term dress what she says?
Yeah.
You look good, you feel good. So
yes. Absolutely.
I'll look every day.
Absolutely. And when you feel poorly, you do poorly. When you don't eat right, sleep right, and get enough exercise, you're not going to be your best person. You're not going to be the best you that you can be. Like the Army nowadays says, be all you can be. They used to say, shut up and get in line. Now it's, be all you can be. But, if you're not eating, sleeping, and exercising correctly, you're not going to be all you can be. You're just not. When if you go to the Army or Marine Corps or any of those things, you're going to go and get a little bit better shape. When I was there, we ran 5 miles a day. This is what you did. We knew that from here to here was 5 miles, and we ran that. I did that twice a day because you go to the thing in the morning, you had to run the 5 miles, but when I got home that night, I had picked out a circle around the trailer park that I lived in that was 5 miles, and I ran that. So that's 10 miles a day. But nowadays, I run 5, 6 steps a day. Right now, I'm lucky to be walking 2 or 3 steps. So here's the deal. I want us to share a little bit about what exercise does, and some of the things that we talk about with exercise is surprising. It was surprising to me. I read that stuff and I said, hey, you know what? That's an amazing thing. So exercise does more for us than we think it does. And one of the things we need to know is that God built your body, made your body, created your body to exercise. And the way that we know that is if you go over here and you pick up some weight and you work with it a little bit, you set it down, you go back the next couple of days and you pick that weight up, you can pick up more weight. Your muscles grow, they become stronger and all of that kind of stuff. So you were created to exercise. And so you'll get stronger as you do that. So this is a little bit of an overview of it. Y'all just hang on a minute. We're going to look at this and then we're going to go over some of the things that to me were a little bit surprising, supported by both peer-reviewed and federal health guidelines. Regular physical activity contributes to improved mental health. That's a little bit surprising to me. Reduce rates in recurrence of use of drugs and alcohol. Enhance physical and psychological well-being, including those who are seeking recovery from mental health issues, substance abuse, or co-occurring conditions, as well as their family members, friends, and loved ones. So we're going to look at a few of the things that exercise is going to do to help us. So integrating physical activity into recovery from substance abuse, mental health, and co-occurring conditions can yield significant benefits. So here's the deal. I have my own little place. Part of our treatment plan. Part of the treatment plan there is physical exercise.
Right.
You have to do physical exercise to be in the program. If you don't want to do physical exercise, you can't be in the program. We also demand Positive self-talk. If you can't use positive self-talk, and we've had people tell me I just can't do that, I feel like that's lying to myself. Okay, go away until you get smarter, and then come back, and we'll do you some good. So that's the two of the things. There's four things, but that's two of the things. So here's one of the things that's a little bit surprising to me, and usually surprising to a lot of folks, is that regular exercise improves mental health. And look, here's the deal. I know everybody in here is pretty brilliant. You know, you can walk, talk, you can do some things. Man, it's fantastic, pretty brilliant. But most of us need some improving in our mental health. Sometimes that doesn't mean that you have a real mental problem that you need to go to the insane asylum over. What that means is that sometimes I suffer from depression. Sometimes I suffer from anxiety. Sometimes I have some bipolarism going on. Sometimes I suffer from ADHD. Sometimes I have some of these other things that's going on in my life. You know, sometimes I just have a real sense of melancholy and I'm real sad sometimes. And people say, well, how on earth will exercise help with that? And in this group, we ought to know. If you go out and exercise your body, your brain's going to release endorphins into your blood system, and you're going to get a little illegal, good high from that, and you're going to feel good. And usually, it doesn't get you super duper high, but it gets you a place of calmness, and you feel good, and it gets you to that place where it says everything is okay. So, physical activity significantly reduces symptoms of depression, anxiety. A meta-analysis. What's a meta-analysis?
Facebook?
On Facebook? No. A meta-analysis means that we just didn't analyze it one time. We analyze it thousands of times. It's about all of those analyses coming together. You know, I mean, there's probably, it doesn't say, because meta means much, bunches and bunches. So there's a lot of different stuff that came in together to show that. A lot of different people have researched it. It's not just one or two people. Randomized controlled trials. These are called RCTs. We do them when we want to figure something out. Randomized means that we're not doing it so everybody can get figured out what's happening. It's random. We may come and check this. We may come and check that. We may go and do that, and then but they're all controlled, so nobody can interject something into that shouldn't be there. All of these. Say it again. RCT, randomized controlled trials. Found that exercise can be as effective as medication in treating mild to moderate depression. So look, I'm a grief counselor, so I have tons of people come to me about depression. You know, when your kids get killed, I don't know if anybody's had that happen to you, but I have patients who do. And they come to me and they are in depression. You know, it becomes a depressive issue when you have children who die, when you have people who die. I've had people come to me whose grandma died, and grandma's 92. You know, pretty much her job in life is to die. You know, I mean, she's 92, but they still come, and they've had this person in their life for the last 60 years. And so they get into some depression over that and stuff. And so one of the things we do is get them to begin some aerobic exercise and stuff like that. Yes, sir?
Yes, sir. I was going to ask you, what are these stages of grief again?
Oh, yeah.
Isn't it like denial, bargaining, acceptance, or something like that?
All of that, yeah. There's 5 different stages of grief.
Write that down.
Well, I don't. I'll have to get them for you because I don't know.
Sorry.
Because my, I have licenses in complicated grief, which goes beyond the 5 stages of grief. You know, you have the 5 stages of grief that everybody goes through. Like you said, anger is the first word. I'm angry at it, and then I'm going to start bargaining, bargaining with God about it, and then I'm going to do what?
So,
Well, acceptance is in there, but acceptance is down fourth or fifth. So there's 5 of them. I'll get that for you guys.
and bargain.
Yeah, denial is. Man, we're gonna do that. See, don't ask me questions that I don't.
Sorry about that. Sorry. Just carry on, please. Sorry.
We're gonna do this now.
I was curious. I thought.
All right, the 5 stages of grief, or something or another. Oh, come on. The first is denial. It did not happen. Second one is anger. We're ticked off at the person. A lot of people get ticked off at the person who died. And okay, and then stage 3 is bargaining. We're going to bargain about it. And then stage 4 becomes the depression stage, and this is where I see most people. And then stage 5 is acceptance. A lot of the times where the certification that I have is for people who don't get to this stage. They get to that place where they think they have accepted it. So if you have some depressive issues and stuff like that, and you go through the 5 stages of depression, and it's 2-3 months after the issue, is it okay for you to still be depressed? Well, sure, yeah, of course. I mean, you've been in group for 10 minutes. Oh, 20 minutes. I'm sorry. Look, y'all, and I know I say this all the time, but he's relatively new. Go to the bathroom before group. We got 45 minutes that we're stumbling around talking to each other, not doing anything. 20 minutes in the group. Okay, yeah, good grief. So anyway, they think they're in that, but 2 or 3 months after something horrific has happened in your life, is it normal for you to still be in grief over that?
Sure.
It can be, yeah. Grief can last for 2 or 3 months. You can't tell a person really how to grieve. How about 5 years? You should.
Drag you down.
Yeah, you should. It shouldn't still be affecting your life after 5 years. I know I have people who've been grief-stricken about whatever. Sometimes it's a dog that died, 20 years later. Well, you don't know how bad Red was. Okay, all right. And look, it's valid, but that's unreasonable. So we have to do something about that. One of the things is exercising. One of the exercise will help you get that. The U.S. Department of Health and Human Services, HHS, which are the people who pay for most of you to be here today, emphasizes that adults should engage in 150 to 300 minutes of moderate intensity physical activity per week to reduce symptoms of depression and anxiety and to improve overall mental health. So when I have people that come to me who are in a real depressive state, the very first thing that I do is put them on some exercise. If you notice, the first part of this, it says exercise is as effective as medication.
Sure.
I try to talk to some of my psychiatrist friends or my therapist friends and say, look, you need to have your patient, and they don't ever, well, that's a good idea, but, I got this here pill. Yeah, or we've got this person on 7 different pills. You really think, yes, if you let that person or get that person to actually exercising to a place where they get their heart rate up 2, 3 times, and then let their heart rate get back down where it's supposed to be. And if they do that twice a day for 3 or 4 weeks, they can get off of 3 of the medicines that you have them on. How many of my psychiatrist friends say, oh, thank you, Dr. Gardner. We'll begin that protocol tomorrow.
Thanks for your input.
Yeah, thank you for your input. Go away. Because if I don't give you drugs, I can't charge you money. Yeah, so Anyway, now and look, y'all, I've had people accuse me of not being not being medicine friendly. That's not true. There are people out there desperately have to have medication. And so if you're on medication, don't just go out there and do some side straddle hops and throw it away. And don't go do 3 push-ups and throw all your meds away. Don't do that. And then go and say, Dr. Barner told me. No, that's not what I'm saying. If your doctor puts you on that, stay on that. Do the exercise. Go see your doctor and say, hey, look, maybe we can moderate that just a little. Maybe we can, because any medicine that you put in your body is detrimental to your body. It might do what you need it to do, but it's not good for you. It hurts your kidneys. It hurts your, your stomach. It hurts all of these other kinds of things. I'm a diabetic. I take that many pills every day. They told me the other day, said, we're going to put you on one more pill, but you have to eat with it. And I told them I can't do that because there's no room left in my stomach. I can't eat, So anyway, I'm hoping to get, I'm on a better diet. I'm hoping to get off of some of those at some point in my life before I croak from it. So one of the other things that a regular regimen of activity doesn't make any difference much what it is. I lift weights and do some stuff like that. Really enjoy resistance training. Been doing that since I was 25 years old, and I really enjoy it. But any kind of movement, I see people playing the basketball out here. That's good stuff. Playing football, running, walking, doing anything, just moving. Most of us in the United States don't move, and those of us in recovery certainly don't move. I see these folks who say, well, marijuana is good for you. And they smoke a couple of joints. How you feeling? Yeah. And so they don't move. So they're not getting enough exercise. They can't move. Yeah. Hey, look at my hand. Look at that hand. Y'all know marijuana is a mild perception distorter, so it'll make okay. So anyway, physical activity can help manage cravings. If you feel like you will, then go do some exercise and it'll get that out of your mind. Making it easier for people to sustain their recovery. If I get into a really good program of exercising on a daily basis, it will help me stay in my recovery. I know people in their recovery, man, when they they work out. There you go. And they're getting healthy and they're doing better. Exercise increases the production of neurotransmitters like dopamine and endorphins, which may be depleted during substance use. When we're using drugs or alcohol, it depletes these things. It gets them out of there, and it makes us crave them. And the best way to get those things is to use drugs and alcohol, because our body when we put junk into our body, it causes these things in our body to stop being produced. And so they're not produced the way that they're supposed to be. This is what causes all the cravings. And so, we're craving like crazy. So if we work out, it does those things. It replenishes those neurotransmitters, but it also gives us that little bit of natural, normal, legal, right, and good high that makes us feel better. Regular physical activity has been shown to lead to lower rates of returning to problematic substance use for people in recovery from substance use disorder. How much use of a mood-altering substance is problematic for us? Any at all. So this keeps us from going back to the use of drugs and alcohol. It doesn't do it all on its own. It helps. And look, if you can do anything, if I could stand on my head for 10 minutes a day, and that would give me a 2.3% advantage over my drug. It's worth doing it. It's 2%. You know, I'm a veteran. I go to the restaurant. I go to the hotel. I go to the parts store. I get a 10% discount because I killed 3 people in the service. I'm thinking I ought to get 10 for each enemy that I off. But they don't look at it that way. They say, okay, they give you 10%. I'm in the line one day, and the guy, I was at the parts store, and I got some parts, and they gave it to me, and they took the 10% off, and the guy standing beside me said, "Well, that's not much. It's 10%, Bubba Head. You ain't gonna get it.
I know that's right.
It's 10%.
That means
10%.
we are paying tax.
Right. 10%. And that's what the guy told me one time. He said it covers about your taxes. Okay, that's great. Yeah, slightly more. Yeah, that's great, right? So it's 10%. The point is, if exercise can help me by 10, 15%, it's worth doing it. It's worth doing it. So it's going to help me some. Physical activity serves as a healthy coping mechanism from stress and may reduce reliance on substances. The biggest deal when I was using drugs or alcohol, the biggest deal I was using drugs or alcohol, the biggest reason was because it was my stress relief. It was my coping skills. It's what I did. When things weren't going the right way, I got some vodka and it didn't matter anymore. When the boss ran me off, it don't matter anymore. When my wife is upset, it don't matter anymore. Everything's all right. It make you feel like one big old chug makes you feel like it, but that one big chug did exactly opposite of what it made me feel and made things worse. So now that coping skill is gone, so I need a new, different, more healthy coping skill, and exercise can be my new, healthy, better coping skill. And so, and look, I do know this, it is really hard to get started. You quit for a couple, I hadn't exercised in about a month, and it's going to not be the easiest thing in the world for me to do it. But I do it because I do it. It's what I do. It's what I do. That's what I do. So I'm going to go do that. If the doctor tells me today I can do it, I'm going to go do it, even if I feel bad. Yes.
Oh, so to piggyback on that, I was going to ask you a question for senior citizens in Germany. Would you consider as something small as calisthenics for good exercise to get started with? Like, knees or something like that?
Yeah, it's always amazing to me that these young whippersnappers look at me and have to talk about senior citizen. How old are you when you become a senior citizen?
Like after 59?
About 60 years old, you are officially a senior citizen. I was a senior citizen 12 years ago. But no, I would think anybody, not just people who happen to be of advanced age, when they first go into it, start off a little bit low. Start off with calisthenics like he was talking about. Do a little bit of something. Don't go crazy. When you go to the gym, I go to the little gym right over here. You go to the gym, I'm going to guarantee you're going to see people in there that are in so much better shape than you will ever be. There was a guy on television who was a bodybuilder, and he was in good shape, and the broadcaster asked him, he said, "How long would it take somebody to get into the shape you're in right now?" He said, you're talking about you? And he said, "Yeah, me. It's about 3 lifetimes." So it takes that. But here's the deal. You don't start off, trying to be a bodybuilder or something like that. But when you go understanding that you're not going to stop at that level. Go up. You want to see a bodybuilding contest? If you get online, Google bodybuilders over 90 years old. There are bodybuilders out there that are over 90 years old. You know, and 80. There's a Mr. Over 60 contest, a Mr. Over 70, a Mr. Over 80, a Mr. Over 90, and there's also a Miss Over 90.
No way.
I've got a good friend. Her name is Pat, and she's a counselor. And you know, everybody here knows Miss Pat and all of that kind. She's a bodybuilder, and she has trophies. You know, and she's amazing, and she's no spring. You know her. She's no spring chicken. You know, I'm not going to tell y'all how old Patty is, but she's no spring chicken because I've known her for years and years and years. But you know, so that's some stuff that you can do. Always knowing I'm going to start out at my level where I am, and then look to build more and more. If I can lift 5 pounds, I'm going to lift 5 pounds, and then next week I'm going to try to get to 6, and then go on up and go on up. I will tell you this. And I've taken a lot of people to the gym with me. 90% of the time, you as a human being can do more in the gym than you think you can.
That's for sure.
Yeah, I've had guys lay down under some weight and say, well, I can't lift that, and they throw it all over the place. So you can do more than you can think, but you don't want to overdo it either, because you'll get yourself hurt. So this also, what's wonderful about this stuff is that it enhances cognitive function and well-being. What is cognitive function? My thinking, the way my brain works. You know, my brain is not as elastic as it used to be. It's not as pliable as it used to be. As you get older, your brain gets less and less pliable. Also, if you've been drinking alcohol for over 20 years, if you've been using drugs for over 20 years, 25 years, something's different for different people, your brain shrinks. Alcohol and drugs causes your brain to shrink. And and it'll shrink up to 20% of its normal size. So you got to think, you know, you're not as smart as you were before you started using. And that shows because we continue using. You know, so your brain has shrunk up to 20%. You're not thinking as clearly as you once were. You know, I mean, that just makes perfect sense. Yes, sir.
Okay, and you say your brain like shrinks as you become sober. Does it grow?
The human body is amazing. You know, if you read the Bible, it says that you are fearfully and wonderfully made. It will bounce back from nearly anything. However, you will never be as good as you were before you started. You've lost up to 20% of your brain size. Your kidneys are not working the way that they used to. They cannot filter well. So what they do is allow a lot of that stuff to get into your bloodstream, but it turns it before it comes out of your kidney. It turns it, not kidney. What? Liver. Yeah, out of your liver. After it comes out of your liver, it turns it into a type of acetic acid. And that acetic acid collects in your bloodstream and goes up into this area around that blank area in there where your brain has shrunk, and it collects there. So your brain now is floating in an acetic acid. And this is what we call wet brain. And so if you shake your head real hard, you can get a TBI. What's that? Traumatic brain injury. Somebody whop you upside the head and your brain sloshes around in this acetic acid that's up there. And so that's really not a good thing. So it makes you kind of want to quit using drugs and alcohol. Sure. Or at least it did me. Although there could be some people who said, man, I'd like to have me one of them shrunk brains. And so just go ahead. Yeah, you know, it's going to happen. Exercise improves cognitive functions like memory. You know, I have people telling me, you know, as you get older, your memory goes away. That's not true. That's not true. You know, y'all know what I was doing this morning.
Remember?
I do. I remember what I was doing this morning. So my memory is still intact. You know, while there was no one around, I took that moment this morning. I get up about 4 this morning. I got up about 3, and I'm sitting in there all by myself. And I said, there ain't anybody around. My wife's asleep. The dog's asleep. Nobody here. This would be a good time to pick my nose. Because ain't nobody gonna know. And if there's a booger that I happen to find and pull that thing out, if it looks good enough, I want to eat it.
What?
There's nobody around. I don't usually eat that stuff.
Sometimes.
My brain hadn't shrunk that much yet, so I'm all right. So look, attention. As when you exercise, it's going to help your memory. So if you find yourself slacking a little bit on that, exercise. Exercise. It will help your memory. It will help your attention. Help you be able to focus, and it helps executive functioning. What is executive functioning?
Decision making.
Decision making, this part of your brain where your executive functioning takes place. It's going to help that to work a little bit better. This may be particularly beneficial to people who are seeking recovery from substance use disorder. Some of the look, when you and I've told this to people. I know brilliant people who use drugs, right? Most of the people I know are not dumb. Most of the people who use drugs are not dumb. But we do some stupid stuff. If we take cocaine, it's going to do this to our brain. Methamphetamines, it's going to mess up our stuff. It just is. And that's not a good thing for us to be doing. From the substance that we use can impair those functions. The substances that we use are going to mess up our memory, attention, executive functioning. Exercise can help to put some of that back. Regular physical exercise has always also been shown to lower rates of chronic diseases. What's a chronic disease?
Would that be considered diabetes?
Diabetes is a chronic disease.
It actually helps me in physical exercise. Helps me with I'm hypoglycemic.
Yeah.
So it helps me from getting diabetes.
I'm diabetic. It's one of the reasons I exercise. But it also helps with heart disease. It helps with coronary heart disease, cardiovascular disease, type 2 diabetes, and some cancer. So exercising is magic. If we're not you're snoring, dude. You're snoring, isn't it? So there's some other things that exercise does. It also gives you some social support and community engagement. A lot of the times when I was using, I wasn't trying to be with other people. Sometimes I did. If those other people happen to have drugs or alcohol, then I would hang out with them. Really, I really like you. Okay, you got some more? And so I'd hang out with those folks, but a lot of the times I just became a social recluse because I didn't want to share with anybody else, so I was going to go do that, take it myself. But group physical activity like team sports or exercise classes, they help you to become more social because there's other people involved in them. They foster social connections, build supportive networks that are critical for you to sustain your recovery. Achieving fitness goals through physical activity also boosts our self-esteem. If you go over here, you don't have to go into the gym to see that in reality. You go over there and you sit outside the gym over there and you watch those folks come out of the gym. You watch people go into the gym and they just, but when they're coming out, their head's taller, their chest stuck out a little bit, they've done something that day. And their self-esteem is up like this. You notice if you go to the store or something and some guy or some girl who happens to work out a whole lot, they're going to come in half naked. Yeah, it can be 30 degrees outside, but if that guy's got a 20-inch arm, you're going to see it.
Yeah.
Look at there. And his goosebumps have goosebumps, because it's 20 degrees up. All right, but that's a boost in himself. Maybe he's a little over himself or over herself. Maybe they need to get a little over them, but their self-esteem, is it better to have self-esteem that's up here than to drag around and hide in the corner because your self-esteem is down there? Yeah, go do something. Go do a little something. Because I'll tell you, the guy that's in the store down there with his chest stuck out, he started right where we are.
That's right.
He started right. I saw a guy working out the other day. I mean, man, his arm about that big around. Looked like a little bitty child, little bitty arms like that. And he looked a little self-conscious, there's some pretty good sized guys in there. And he's getting his little 5-pound weight. He's doing what, but look, I remember back in the day when I got my little 5-pound weight, and I can remember the day, just like it was yesterday. I was at the gym over here in Beaumont, and this was probably 40 years ago. But I can remember the day when I was doing some tricep pull down, and I managed to get to 30 pounds. My God, 30 pounds. I thought, man, that is fantastic. And it was at that time. Nowadays I can pull down 70, 80 pounds. And there's one machine that has 140 pounds on it. I can do that whole 140 pounds because my triceps pretty strong. Back then with that 30 pounds, that was a big deal. But it didn't start with 30 pounds. It started with 5. So wherever we are, we have nowhere to go but up. So we can head out and do all those things. So it helps us do that kind of stuff. It's going to boost my self-esteem and self-efficacy. What is self-efficacy? We know what self-esteem is. What is self-efficacy? What's that?
I believe it's your ability to do things.
Yes, I can believe I can do it. My self-efficacy, I believe in myself. Yeah. Self-esteem means I feel good about myself. Self-efficacy means I believe I can do things. I can do this. Yeah. And so when somebody says, hey, can you do that? Say, well, yeah, I got me some good self-efficacy. Yes, I can do that. Nobody else could. Well, I ain't nobody else. I can do it. Come on, let's get her done. Let's get started. Yeah, I can do that. If I can't do it, I'm going to stumble up trying to do it. I'm going to be in the midst of getting her done. And if I can't do it, I'm going to figure out how come I can't do it and then do it. So we can do it. So look, it helps us with those co-occurring disorders as well. What's a co-occurring disorder?
I would assume a disorder that helps another walk with, but I'm not sure.
That's never stopped you before, though. Oh no, but let me tell you this. Co-occurring, it's like dual diagnosis, a co-occurring disorder. I have schizophrenia, but I'm also an alcoholic. So dual diagnoses, you have to have, one of them has to be a chemical addiction, and then the other one can be anything. I have depression, but I'm also an alcoholic. So that's co-occurring.
They call it polysubstance.
No. Polysubstance abuse is when I abuse multiple different things. When I abuse, we used to use that a long time ago. We don't use it as much anymore because we used to think that we used polysubstance abuse as using a whole bunch of different substances, but now it's different. It's still using a whole bunch of different substances, but we have to be diagnosed with each individual substance. I am an alcoholic. I have cocaine issues and methamphetamine issues, and so that's put them all together, and it becomes poly. So physical activity provides significant benefits for people with co-occurring mental disorders and substance use disorders by improving both physical and mental health. Remember, if I get better, I do better. If I feel better, I do better. So data suggests the integration of physical activity into clinical treatment for people with co-occurring disorders results in better outcomes. So here's the deal. We talked about physical activity, exercise, is just as good for us as the medication. So if we're taking the medication and doing the physical activity, we're going to get somewhere quicker. We need to be doing all of that kind of stuff. So here's some practical recommendations, and we already know these, so we may not spend a whole lot of time on it. These are some things we've already talked about. The following recommendations are for the practical inclusion of physical activity for those who may be or seeking recovery from challenges related to mental health, substance use, or co-occurring conditions. Of course. There you go. Yeah. Been here almost 5 seconds. Start gradually. We already talked about that. Don't go over there and try to be a bodybuilder right away. Start gradually. Begin with low intensity exercises, then gradually increase intensity, duration to ensure long-term adherence. What that means is adherence means you're going to stick to it. If you go over there today and work your butt off, that'll be the last time you went, usually for most people. I had a deacon in my church one time many years ago, wanted to go work out with me, and I said, okay. He's a big old boy, big old guy. Went into the gym, and he was big and flabby, and he couldn't pick up a whole lot of weight or anything like that, but he wound up at one of the machines that you put the deal on your shoulder, and you just got your calf muscles going like that. You can put more weight on it. He got 400 or 500 pounds on that, and your legs are strong. So he got there, he pushed that up, and he said, man, I can do this. And I worked out for an hour and a half, and I went over, and he's still there. I said, dude, you need to calm down. So when he got off that thing, he was walking kind of like that, and I said, okay. So he didn't make it to church. That was Saturday. Sunday, he didn't make it to church. Finally, after 2 or 3 days, his wife called me. She was mad and wet sitting here. She said, man, he ain't been able to go to work in the last couple of days. His legs are so stinking sore, he can't walk.
I said that to myself.
Yeah, I told him so. Look, don't go. And that was the last time he went to the gym, with me anyway. I don't know what he did later in life, but, he didn't go with me. And that's usually, take it easy on that first day or two, because I guarantee you, go over there and hurt yourself, you won't be going back.
Have you excuse discretion, please?
Say it again?
Have you excuse discretion?
When you've been in group, man, all this time, good God Almighty. Look, yeah, we're about to take a break. We'll take a break. We'll be back about 15 minutes after. Please consider this. I know this is hard. I know this is really tough. I know this is beyond the pale. Try to, I don't know, try to go to the potty. Stuff like that before group or during break. If you can't hold it, you can't hold it. We don't want you to tinkle on yourself or anything. And, aren't there bathrooms in every one of these rooms? Yes, there is. There's bathrooms in every one of these rooms. It never fails. I want to go to the bathroom, and there's the bathroom right there, and there's always somebody in there. Y'all got 9 bathrooms. You use the only one out there that I can go in. I don't know what that's about. You just like to pee where I pee. I guess I don't know what that's about. But or I'm in the bathroom and somebody knocks on the door. Let me just for your own information. If it's locked, more likely somebody off in there. If you can't get in, there's probably a reason. But people, I hear them. I'm in here. Yeah. All right, look, be back. Go ahead, man. But I don't want you to take it on yourself. All right. Thank you, guys. We'll be back 15 minutes after. You want something?
Anecdote. Going to the gym and overdoing it the first time and everything. There's these exercises called thigh abductions and I think the other one's inductions. One's where you push in and the other where you spread out. Oh, God. So I did a bunch of those, 70 pounds, didn't feel like I'm doing good. The next day, there was a fire alarm. I had to climb 15 flights of stairs. I was walking like I could ride a horse all day for 2 days.
Oh, yeah.
Y'all redo y'all rooms. Get all the stuff off those Off the desk, off the nightstand, off the bed.
Thank you, sir.
Is she really
Hey, now, Brew, you said if y'all got stuff on y'all nightstands,
I have this is built. You can't have it like that. You gotta fold it up and put it in the top. I need to put it nice. You can't have it.
man, I keep forgetting to change the sock. The sock that you said is oh, I'm trying to tell you.
you know, tell you good advice. Just like, hey, I'm good. I don't need your advice.
It's like this advice for your shirt. I don't know.
Come on, another try. You know, I love you there. That's me. I love you how you are.
But I don't know we don't talk about it. It's me, don't look. Yeah. Really,
It's just a lot.
I don't know where I was. I was like, wait, because at first it was like bigger. But it was, yes, working on the sides. Yeah, I was. When it does say here,
What up, Mr. Washington?
Hey, man.
You alright?
Uh,
How's your weekend?
wasn't bad. Shit, I wasn't bad at all. To be honest. Chilled out with the wife and kids. And
Yeah.
it was all right, man. Said,
That's good.
yeah, that's what's up.
Yeah.
Mr. Washington, on May 16th, is that like it on the edge of the pavement like that, or we'll take it off?
Yeah,
Like,
watch it every weekend. Fill up. Now, not to say that when you go to sleep tonight, you can't use it. You just can't.
You can't decorate it.
Yeah, yeah.
so I got.
Can't decorate.
I didn't mean it.
Now,
That's what I got.
me
I
personally,
do.
I think it looks nice.
I went
But when the brother comes back, she comes back, she gonna look dead, she comes dead back here. So yeah, you can't decorate it.
And ready to go home, right? I can see it all in you.
It's
I see something on your mind. I think I do. Anyway.
yeah, oh no, you're not wrong. You're not wrong, dude. You're not wrong. You hit it right on the head. I'm just not acknowledging. Yes.
Hey, you alright?
Yeah, I'm all right. I'm gonna be okay. It's just stupidity. I have to deal with the stupidity. That's it.
Man.
Shout out to check. So, what was the score last time? 42-38. 42-38?
Get your ass in
Check back in, check up.
Do you like coffee or do you prefer black? Black? You do? I want you to just try just a little. Not much. Yeah, or just try a little. Oh, yeah. What's that? That is me. Yes. That's delicious. Can I tell you my secrets? We'll be like drinking coffee every day. I'll share it. But like, yeah.
Let me finish this one.
No, you're good. I was like, I don't want to become my brother. I'll grab all my coffee fixings. And then I'll be sad. And then my parents would be like, we're going to go on Southern Barcia. Let's see what the hell was. I was too kind. And then I was the champion. And the money was private. You tasted something. It's not like a big process. So, I watched it like this guy's talking about 4 or 5 people. I had 4 rounds be like, this will be better. No sign. It's just not what you need to do. A little close to wrong. Wrong. Last side of it. It's time to collect that question.
I think it's kind of five.
That's all.
5 times 9? Yeah. 45? Yeah.
We have one more of the signing sheets. Well,
Yeah, I put the other one there. And remember? I think this guy.
Let's move on, man. Can't tell them that. I'm going to take care of you.
Whoa, look at this. Did you jump on that? I think he's going to hit the ground. I always stop. He's like, dude, he's going to break a leg. Way too close. He's definitely going to break a leg.
Only one. Oh my God.
He's going to break a leg. I turn up the heat. Jab handles. So when we got assignments here, do we got a copy of all the Like, do they want us to write all this and write this as well? So question. There's so like real word. It says, how can share I want to start this time through question cover from in the workbook. Following completion of the assignment, all we can share this. It says in the work. Yeah. Then in the number 3 in the work.
You do it in the work, but you do only that.
Yeah.
So they say
Sleep. Sure, that sounds like a sermon.
eyes and out.
Oh, no, that's
This position is great.
seriously?
No, literally. Do that position. telling you, after this is
Thanks a
and
lot.
be eligible like a whole time. You're just gonna be like, don't shoot the spoon on me. Oh, spoon shit.
I hate that. So,
I'm sorry we get started just a little bit late. That appears all right. We're at the whole front row who hadn't made it back. Just real quickly on this, we're going to go over a few more things on this. But remember to start gradually. The big deal is we don't want to hurt ourselves. We want to help ourselves.
That's
So
right. Don't teach
if
yourself,
we
treat yourself.
say it again.
So don't teach yourself, treat yourself.
Yeah, absolutely. We want to make sure that we're doing ourselves some good,
Right.
instead of messing ourselves up. So, and the other thing is to try to change it up a little bit, incorporate a variety in your routine. That does a couple of things. First off, it's going to help your muscles to grow if that's what you're wanting to do. The other thing it's going to do is keep you interested. If you do the same thing every day, it's going to get pretty, yeah, and you're not gonna enjoy it like you should be. I'm just watching people have their vote. A combination of aerobic exercise and flexibility exercises. Aerobic strength and flexibility exercises. It just helps you maintain your interest in it, and it also maximizes the benefits of it. If you don't enjoy it, you're not going to do it, and if you don't do it, you're not going to get the benefits that you're looking for. And one of the things we need to do, and I told you guys a little bit earlier, that I really enjoy going and doing that. I really enjoy working out, all of that kind of stuff. It makes me feel good, and I feel good about myself and all of this kind of stuff. So make sure that whatever you decide you're going to do, you're going to enjoy it. If you don't enjoy it, it becomes tedious, it becomes a job, it becomes labor intensive, and you're just, after a while, you're just going to get tired of it, and you're going to stop. Choosing enjoyable activities, it increases your motivation, and it increases the likelihood of maintaining that active lifestyle. If you don't enjoy it, you're not going to do it, right? So make sure you like it. One of the things that we don't do a whole lot of is consult your doctor. If you're not sure that you want to go exercise, if you're not sure that it's something you need to be doing, you need to go talk to your doctor, usually your family doctor or PCP, because that person usually knows your level of what? Health, where you are, what might hurt you instead of helping you. So if you go to the gym and you tear something up, that's not going to work out for you. So you need to let them know that this is what you're doing. Every doctor that I have knows that I work out, and every one of them pushes you up for that and says, man, that's a good thing to do. One of the things, I did a study not too long ago on ageism, and one of the things that I learned is that resistance training is very, very good for you as you age. It's one of the things that we should be doing. Unfortunately, we go in the other direction. I went to a funeral not too long ago, and one of the fellas there came up to me, and he had a big old gut and all of this kind of stuff, and he said, man, how do you keep from getting a big gut like that? You ain't got no gut at all. I said, well, I work out 3 times a week, and I do this and I do that. And he said, oh, well, I'm getting too old to do that kind of. That's the point. As you age, you need to incorporate some resistance training in there. It not only helps build your muscle, which over the age of about 35 we began to lose muscle continuity. So we need to be exercising more. Over the age 35, 40, you need to begin putting some of that into there. You get my age, I'm 72. It's a real good thing for you to be doing some type of resistance training. You don't have to sign up for a bodybuilding contest. You don't have to do that. But you can go and pull some stuff. I was working out at a gym over here at the at St. Elizabeth. They have it's right there next to it. They have a gym over there. It's upstairs, and it's a really nice gym. And I was working out up there, and this was several years ago, and there was an older gentleman in there, he's about 75 years old. And, I'm just kidding with him. I was over there working out near him, so I said, why do you think we keep doing this junk? And he said, well, I do it to stay alive. Okay, that's exactly the right thing. We need to do that. One of the things that we don't realize is not only does it help your muscularity, it builds your bones. It strengthens your bones. It causes the marrow in your bones to increase in density. And that's a really good thing. Is he writing you notes or?
No, I was
You showing him what?
I was showing process works.
Oh, oh. Well, I'm thinking if it's that interesting, you ought to just share it with everybody, man. I mean, we're not interested in this stuff, so, maybe what you've got something we've been in. If you have any concerns, some of us have some medical issues, right?
Sure.
Some of us do. Some of us have some medical. I'm diabetic. I have some stents going toward my heart. I have some stuff, going on with me right now. So before I'm going to go and put my body under any kind of strain, I'm going to go talk to my medical professional that's in my life so that they can tell me that's a good idea or that's not. My cardiologist has told me to stop exercising. Don't do anything right now. For this, I haven't done anything much for like the past month. I've been having all of these pains and everything. I've got some, I did a CAT scan on my stomach, which said I had some calcium deposits that were getting pretty severe. And so they said, look, don't do anything. Just, you come see us. So today at 2:30, I'm going to be up there talking to them. But if you have any concerns, so I had some concerns, and I'm talking to those folks. So if you have any concerns before starting or during physical exercise, if you think, well, you know what, this here may be a problem, go talk to your doctor before you do that. If you're exercising and something hurts, the other day I was doing some bench presses. When I was doing some brain crushers, and my elbow here just started, my God, really hurting. So I didn't stop the set, but I lowered the weight just a little bit. And then I researched it a little bit. I'm doing it just a little bit wrong. And you're not exercising the muscle as much as you're putting stress on that tendon and all of that stuff. So, I had to change the way that I was lifting. And that seems to have helped. It still hurts a little bit, not much. Including those related to other health problems or symptoms. Talk to a medical professional. Go talk to your doctor. That's what the heck they're there for. One of the things that we don't usually, now I'm not talking to everybody, but there's a bunch of us that don't usually understand when we go to see the doctor who's in charge.
Yeah.
You are. You're supposed to be. You're the person in charge. So it's your body. And you're paying all the bills. That doctor drove up in a Maserati, you're paying for it. Yeah, so it's you. But just because a guy wears a white coat and a stethoscope, okay, you're still the person in charge. So tell them, this is what I want to do. I'm not going to ask you if I can do this or not. This is what I want to do. Tell me how I can do it without hurting myself. Tell me, if I've got these stents in my artery going to the heart, I have 3 of them, is that going to, so for a year, I couldn't work out. My dog, my wife's dog, I don't own a dog. My wife's dog knocked me down and broke my shoulder bone, and it was poking up like that. And if you ever have anything like that happen to you, go to the Fondren group. They're a good group of doctors. Don't go to Bone and Joint. The doctor, my doctor at Bone and Joint says, "Oh, just live with it." You know, most people do, and it's just, I know it looks bad, but it ain't gonna hurt. So I went to the Fondren group, and they said, "Hey, you want to do something about it?" I said, "Yeah." They said, "All right." So they cut it open and fixed all that stuff. But for another year, I had to just walk, and I couldn't do any heavy exercise. But now, yeah, after a while, I could. So make sure your doctor knows what you're doing. And by the time you get my age, I have so many doctors. You know, that's why I have to keep working. Somebody's got to support those people. You know, it's amazing. So, data suggests that physical activity can play an important role throughout a person's recovery and wellness journey. Here's the deal. Recovery is not just about not using. What is that? That's sobriety. That's just staying sober. We want to stay sober. That's the hugest, biggest part of this stuff. We want to stay sober. But there's a whole lot of other things too. When we get into recovery, that is not just not using, that is a lifestyle change. Now, if you think about it, we say stay away from old people, places, and things. In order to stay away from old people, places, and things, and I know there's a ton of people listening to me right now that knows they're not going to do that, right? But if we stay away from old people, places, and things, that's going to cause us to have a complete shift in our lifestyle. That's a complete new lifestyle. That's what recovery is. If you're not willing to do that, you're not in recovery, and you won't be. That's just what that is. That's just how that is. Everybody's been in sobriety for 15 minutes. Just about everybody can get into that. But getting into recovery means a complete, total shift in my lifestyle. Complete change. So if you're not willing for a complete change, then it's not going to work for you very well. Now, is that true for everybody? No. There's always an outlier. There's always that one person who's going to go back to work in the bar and go back to the same old guy or the same old girl who's using drugs every day of their life. They're going to go to the same thing, do it, and they're going to make it. But I'm going to tell you something. It's just like winning the lottery. Did y'all notice that $1.7 billion got won the other day? Wasn't us.
No way.
Wasn't us.
179.
Yeah. Say it again.
You say 179, 1.7
It was $1.7 billion. $1.7 billion. And I don't know who, but somebody somewhere won all that stuff. Praise God, it wasn't me. My goodness, I would go crazy. But you know what's funny about that? When you win $1.7 billion, the government immediately takes $1 billion. They leave you with $700 million, which sounds like a lot. But then they tax that.
He's not lying.
So you get about half. You get about $500 million. That's still $500 million. I could put that toward my bills, and I'd be in pretty good shape.
Actually, it's $480,000.
480
billion.
Yeah, $480 million, and it started off. I'm thinking you already took $1 billion. Why do you need another 20% tax off top of it? Anyway, we ain't talking about that. But that's about the same chances you have of being sober if you don't have a lifestyle change. So, we need to make that lifestyle change. So, and see, this is a person's recovery. This helps on a person's recovery and wellness journey. Benefits includes a better mood. If you feel better, you do better. If you be able to do other stuff, cognitive improvement, you're thinking better. And I'm going to tell you something. We all need to think better. We need to get that one thought out of our minds. I was at a deal, and you know what? I was over at North about 6 months ago, and we were doing something, talking about staying clean and sober and all the stuff we always talk about. One of the ladies, she's been gone a long time, she raised her hand, and I said, "Yes, ma'am." She said, Dr. Garner, she talked just like that. She said, Dr. Garner, how long do I have to stay sober before I can have a drink again? What do you think I told her? What'd I tell her?
Can't never drink again.
You can look. No, I didn't tell her that. She's a full-grown woman. You want to go drink? Bar's right down the road here. There's a little store right over here, about 10 feet from the place. Go over and get you a 6-pack. You don't have. Look, you can. If you're going to wait for 10 years, you might as well do it now because it's exactly the same.
Right.
You know, you got to get into recovery or shut up. You know, I mean, you can't ever go. Look, we're gonna change our lives overnight. You know, so don't be thinking, you know, we're going to get our cognitive ability in a better shape. And when my brain, my thinking gets to where it's supposed to be, there is no way I'm going to be thinking at some point in my life I'll be able to use again.
Sure.
You know, we're full-grown people want to use, go do it. You know, we can do that right now. There's no one going to say, I'm going to keep you from going. I'm not going to follow you home. I'm not going to slap you up if you're going into the liquor store or, you know, going to see Bubba down on the corner. I'm not, you know, that's a you thing. And it's going to need to be a you thing. And that's when I've changed my lifestyle. That's when Bubba don't know where I live anymore. Bubette don't know either. So, making it a valuable component of recovery pathways and services. Exercise needs to be a part of that. So, some of the highlights we looked at will tell us that, hey, you know what? We need to do some of these things. Real quickly, probably going to get out of group early. Did that hurt anybody's feelings?
Ouch.
No, it hurt your feelings. I thought it would. If y'all call, you know, if it hurts your feelings, you have to call HHSC and tell them that we quit group early because Mr. Washington made us quit group early. Oh, I'm sorry. I see you over here. What you you had something? You had I think there's a string stuck on your hand. And you sit there and every now and then somebody.
Well, I'm always going to tell them there ain't no such thing as stupid questions. So.
Well, that's true. There ain't no such thing as a stupid question. Some of them get pretty close, though, don't they?
I know.
Some of them get close. Look, here's some of the things. We're going to look at this real quickly. This is the effects of physical activity on your body. Y'all get a hold of this, and if you want one of these, I will give you a sheet. And it can be in color and everything else if you would like one. Pretty cheap, too. It ain't going to cost you a lot. So this is effects. This is what physical activity does for you. Your brain. It affects your brain this way. It has a calming effect on your brain. It helps you to recover from stress more quickly. Doesn't keep the stress away from you, but it will help you to recover from it. People who are exercising and in good shape can deal with stress 10 times better than other people. If you have a stressful job, when I was working out over by the hospital over there, I worked out with this big old huge guy, and we'd work out every day, you know, and he was just a really heck of a nice guy and all of this stuff. And then I ran into him in the where you go get dressed. No, where you get dressed to leave.
Oh, the locker room, man.
Yeah, anyway, that thing. And he was putting on his uniform. He was a Beaumont police officer.
Come on.
So that's a real stressful job. Now, he didn't stand up there and say, hey, I'm a cop. But when he put that big old gun on and everything, it's pretty obvious, you know. But that's a real stressful job. And, you know, when you're working out, all of that kind of stuff, it helps you deal with the stress of your job. Every job has some stress in it. I was in my office the other day working like a Hebrew slave. I was getting, and my boss lady stepped inside the door. Did that cause any stress? Yeah. Just a little bit. You know, just a little bit, but she had sent me 4 things to go on the calendar, and she said we're going to meet this day, this day, this day, and this day, 4 days, right? Down through the year in 2026. Made me feel pretty good once I figured out what she was doing, because I said, well, she ain't going to fire me. She's got me. I'm going to be in these meetings for the whole year. But I thought she had messed up sending me all 4 of those, so I just put no, 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 no. And so she came to find out why I wasn't going to come to any of her meetings. So, okay, so that was a little bit stressful. It can cause a little bit of stress, but if you're working out and you're in good shape, then you can deal with that.
That's right.
This morning, I have what's called a morning huddle. We huddle every morning, and so if y'all looking for the staff, they're in my office at 8:00, and then at 4:45, they're usually at their office. 4:45, the evening huddle. We talk about the morning that's going to go, what's going to happen that day, and then in the evening huddle, we talk about what actually happened. So it's a pretty good plan. This morning they were like 17 minutes late. That stressed me out. I wasn't happy, so I sent a little thing down to one of the counselors down there, and I said, "Morning huddle." Put a little question mark, and they came down to my office, and there was a perfectly good reason for that. So but I was stressed because what was the difference? Communication? It's always a bad thing.
I would say responsibilities. The difference for that is when Miss Sierra came to my office, that was back a little while, I was working out every day and I was feeling good, and this hadn't started. This has been here a month. When I feel good, I do good. Stress don't bug me when I feel good. Okay, yeah, that's a stressful situation, but I can deal with that, right? Yeah. But when I'm feeling like I'm feeling now, little bitty thing, that's a little bitty thing. They had a little something to happen. That's a little bitty thing. And so, anyway, it helps your brain on those kind of things. It gives us more energy in our brain, increased alertness, and helps us to sleep better. I guarantee you sit around all day long and you nap a little bit. I do a thing with helping people get to sleep. And about 90% of those people will come and tell me, well, I just don't sleep at all. Is that true? No. Because as you go along, just like in here, people will nap a little bit. They'll go to sleep a little bit. They'll have these 2-second, 3-second power naps all day long. They do that kind of crazy mess. And then they'll tell me the other thing is, I know why I can't sleep. You know why I can't sleep? It's because my brain is different from other people's brain. It never shuts off. And I think, man, that makes me so special. Let me tell you something. Your brain, nobody's brain ever shuts off. If your brain shut off, you die. You fall over dead. Say, hey, look, his brain must have shut off. Yeah. But your brain, nobody's brain ever shuts off. So it's not like that. So if you exercise, stay awake all day and exercise, you will be able to sleep at night. What were you saying? I was just saying that I was agreeing with you that.
Oh, okay.
When your brain's not shutting off.
No.
It's in room.
Yeah, it goes to a different place, but it's not shut off. So you're going to sleep better. Now your lungs. And this is important for a bunch of folks in here. Most people, when they talk in group like that, they whisper. Not these guys. Hi. Yeah, look, did you hear what that idiot said up there then? Yeah. But this is good for most of us in here, because most of us are going to go outside and commit harikiri. What's that?
That's a ritualistic form of suicide.
Yeah, suicide. And so when you go out there, you're going to light that cigarette up. So this is good. Exercise is really good for your lungs.
That's right.
Your lungs and something else that help you breathe in, and the muscles that help you breathe in and out become stronger when you exercise. It helps your skin. Your skin is actually an organ in your body, or on your body, and It gets a better glow about it, and it improves your skin tone.
That's pretty neat.
It is pretty neat.
I never knew that.
I never heard that either. I'm just watching you guys. I mean, it's amazing. You can move and you go, "Ooh, he moved again." Ooh, yeah. Muscles and joints, it's going to help your muscles. You've got to know it helps our muscles. It increases the flow of oxygen to your muscles. Your muscles and the tissues holding your muscles to your bones get stronger. Your joints become more stable. Your joints will become more flexible and less likely to be injured, and your muscles get stronger. That's pretty obvious, right? Heart and blood. Your heart gets stronger, and you have a larger heart muscle. You know your heart is a muscle, right? When does your heart rest? When you sleep? No.
When it stops.
I need you to define what you mean by rest. You mean coming down to its natural pace?
I mean resting.
Well,
when it stops, you're dead.
Right. So you mean whenever you're not being actively
Yeah, whenever you're not dead, but your heart is resting, when is that?
When you're not doing very much.
When you're not doing very much, and it's no.
When you breathe.
When you breathe out? No.
Never.
Exercise.
Your heart. Never. He said, my heart ain't resting at all. That sucker better be working is all I got to say. Your heart rests between beats. It goes, boom, rest, boom, rest. So this is why we're really concerned when you go and do your blood pressure, what the lower number is. Because it's like 120. That's your top number. That's a good number. And then you got 75 is your lower number. That's a good number. My wife's numbers sometimes are like 400, and her bottom number will be like 200. That's really bad because why? That tells us that her heart is not resting. So if your bottom number is high, then that tells us your heart is not resting. So it makes a big one and then a small one. Boom, boom. That's why your heart, when you listen to it, it don't go boom. It goes thoo-thoo, thoo-thoo, thoo-thoo. So it's working, resting, working, resting, working, resting.
Is that why on the thing it goes choo, choo, choo?
Yeah. And when it goes doo, 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 that means you finally quit smoking.
That's right.
Yeah. Finally quit smoking.
Went home to the Father.
Yeah. All right, so it does all of that stuff, and it helps. Your heart does not have to work as hard to pump blood to your organs. Have you looked? I have a room in the back of my house where we put all our Christmas stuff. Some of those boxes are super heavy. I have a son he weighs probably 400, 450 pounds. He's a big man. He's 6 foot something, and he's just huge. And so when I get back there and try to lift that up, to get it up there, I can't usually do it. So I'll call Paul. Paul will go put it up there. So what's the difference? His muscles are 3 times the size of mine, and it's just no big deal. So when your body, your heart is stronger and larger, it takes it a whole lot less work to pump that blood through your body the way that it does. So that's helpful. That happens when you exercise. The body enjoys increased blood flow throughout the body. Why is that important? What does the blood do? It feeds your cells. Every cell in your body, when your heart pumps, every cell in your body gets nutrients from the blood. And then as the blood leaves that nutrient, it takes the waste out of it. So the blood is feeding and then cleaning. It's feeding and then cleaning. So it's important and if it doesn't happen, that portion of your body dies.
Is that like protein synthesis for the cells?
No, photosynthesis. Well, that's what plants do. protein synthesis. I don't know. I'll have to look that up because I'm not sure what that is. Stomach and intestines. This, if you exercise, you will have less constipation. I don't know about you, but I seriously want to have less constipation in my life. You know, when somebody says, what is it that you really would want for Christmas? Less constipation. You know, I just don't like that. I don't like constipation. I also don't like the other extreme. You know, when you have projectile vomiting and the other way as well. That's not, sometimes I don't like that kind of stuff. You know, maybe every now and then for a change of pace, but not very often. You know, so it will help with constipation. Your bones, exercising helps your bones. This is why it is very, very, very needful, important for older people to do some resistance training. Your bones increase in width and in density, making you less vulnerable to bone breaks. You know, as you get older, you fall down, you break things. I've got a gentleman in the hospital right now that I'm not sure he's going to come out of the hospital, and he's just falling all the time. Yeah, you know, one of the things that would have been really good for him, he is a retired engineer, and he's about 75, but I don't guess he's never been in the gym in his life. You know, never goes over there. But that would have been very good for him. Right now, the doctors are not letting him stand on his own because, you know, if he stands up, he's going to fall down. So, you know, this helps us not to fall down as much. And if we do fall down, we don't break things like we were doing. So it gives them, it makes them wider and gives them more density. There are some other organs. Your posture or the way you hold your body will improve as regular activity keeps your body flexible. You want to be flexible. Your body will start to get rid of extra fat in your vessels and body, and you can lose weight. One of the things that I do see in the gym from time to time are obese people. Every now and then I've seen some people that were just huge, and they were working toward getting that stuff off of them. And that's a really good thing. That's a really helpful thing for them to be able to do, to get some of that stuff off of them. You know, because if you're overweight and stuff like that, it can be detrimental to your health. And so, you know, we need to do that. So, questions, comments, or snide remarks? Yes, sir.
I remember in Parkville Mall here in Beaumont, a long time ago, they used, in front of GMC, they used to have like one of them weight things you go on, put your hands on, and then no matter, it'll tell you your BMIs, your body fat, your everything, how your height, and like what you're supposed to be at and everything. But I was wondering, like, do you ever go on a chart like that?
Yeah, I have. I know what my BMI is and all of that kind of stuff, but I haven't seen that machine.
I know. That's a good machine. You put your hands on there.
I wish that they had.
Yeah.
You know, we need to have those things.
For sure.
There's one in the Walmart here.
There's one at the Walmart.
I looked at the other day.
I know at the Walmart there's one to get your blood pressure checked.
Yeah, in the back of the pharmacy.
Yeah.
But I'm mistaken. It might be one of the cheaper ones.
But this one, you can stand on it, put your hands on it,
And I'll get
height, weight, age, and everything. It costs $1.
Cost $1?
Yeah, you just put it
No
on.
wonder they took it out. I ain't gonna pay them $1 for it.
Salt free, never mind.
But look, when we take a look at all of this stuff, the thing that we need to know, the thing that we need to get a hold of is that this is really good to be in our recovery. If I'm going to be in a long-term recovery, I'm going to have some of this in my life. I'm going to have to start doing something. And if anything that I do is going to, if that's going to help me by 10%, is going to help me by 5%, I need to do that. So, thank you. Good group. Y'all did a really good job. Ladies, I'll be coming over after a while before I do my notes to pick up those things over there, and I appreciate y'all.